Is it visible now?
We can see, sir. Yes, sir.
So I just made some question and answer type for this description. So first, what is biomedical waste management? Why it is important? So biomedical waste management involves the safe and effective handling of waste generated by activities including diagnosis, treatment, research, mainly to protect the public health and the environment. That's the main
Yes, sir.
reason. And what are the steps in the management of biomedical waste? That first thing is all the waste should be segregated. So at the point of generation itself, we have to segregate them into different categories like sharps, infected materials, waste, and to facilitate proper treatment and disposal. That is the first step. Second is how you have to collect them and transport them for final disposal or should be collected in designated containers and transported in vehicles to prevent any leak to the outside. And they have to be treated before you dispose them in whatever way you want. So render it safe for disposal, and the methods such used for the treatment are autoclaving, incineration, chemical reagents, etc. And the last step is the disposal. So segregation, collection and transport, then treatment, then disposal. And treatment should be disposed in a manner that is safe and environmentally sound. It is very, very important. And in addition to all these things, the persons doing that also should be periodically taught and trained. So training and education is very important. So healthcare workers and waste handlers should be trained on proper management of medical waste. So which government agencies are involved in the biomedical waste management? The Central Pollution Control Board and the nodal agency is the form of they form the rules. But who implement those rules are the State Pollution Control Board. So the rules are formed at the central level, and the implementing the rules in each and every state is at the control of the State Pollution Control Board. And what are the types of waste classified by the WHO? So there are different types. First type is called the infectious waste, which arises from the laboratory operations, including infectious agent cultures and stocks, as well as wasted materials and contaminated with blood and other body fluids. It may be from autopsies or from sick patient bodies like swabs, bandages. So infectious waste is the first and foremost type. The second type is the pathological waste, which is human body parts after an amputation or this will be mostly from the surgical OTs, where you get the human bodies after removal from cancer surgery or trauma patient. And the third is the sharp waste. This can be generated anywhere in the hospital. It can be from the ward, it can be from the outpatient, it can be from the OT. And they are all the commonly used syringes, needles, scalpels, and blades. And there can be chemical waste, which are all solvents, reagents used in the laboratory preparation, testing, etc. And the sterilizing chemicals that we use and heavy metals which may be contained in that. And then pharmaceutical waste is the drugs that are wasted or expired yet drug, immunization, vaccines, etc. And cytotoxic waste is mainly generated in the cancer institutes and the hospitals dealing with cancer patients, where they use a lot of toxic substances or cytotoxic drugs. And radioactive waste, such as products contaminated by radionuclides, including radioactive diagnostic material or radiotherapeutic material. And lastly, non-hazardous and general waste that does not pose any particular biological or chemical, radioactive, and physical form. So these are the 8 types of waste classified by the WHO. So infectious, pathological, sharps, chemical, pharmaceutical, cytotoxic, radioactive, and non-hazardous general waste. Now, We must know from where are the sources of this biomedical waste. They will be mostly from government hospitals or private hospitals, nursing homes, dispensaries, primary health centers, research centers, paramedical. These are all the major sources. And it may be from veterinary and animal research centers also, and biotechnology institutions. The minor sources are small clinics run by physician, dentist clinic, animal houses, slaughterhouses, blood donation camps, and vaccination center and psychiatric clinics. In all these things, we can be getting the biomedical waste, which are considered as minor sources. And first step is the segregation. What we saw, how do you segregate in the hospitals? So that is where the color coding comes. You have usually these four types of color codes are used. Maybe yellow, red, black, but it may be blue in some cases or white. It may be alternating or it may be different in different places. But commonly you will find it yellow, red, and black in most of the hospital. And the fourth one may be a blue or a white. And what are the ways that have to be? So this picture, if you remember, it is easy for you to answer in the ASCII. So yellow usually human and animal waste, microbiology waste, soil, cotton, dressing, linen, beddings, etc. Red is for IV tubings, catheters, IV sets, etc. It is uh, disposable IV sets, etc. And the blue or white is used for sharp waste like needles, syringes, scalpel, etc. And black is used for discarded medicine, cytotoxic drugs, and chemical waste. And these waste, how are they treated before they are being transported or disposed? Is human waste are all incinerated or into deep burial. And the rub tubings, disposable catheters, IV tubings, etc., they are treated by autoclaving, microwaving, or chemical treatment. And waste are again treated by autoclaving, microwaving, chemical treatment, or destruction and shredding. And most of you would have seen this shredding of the syringes, disposable syringes after use in some labs and other things, where the syringe will be cut into many pieces so that it cannot be reused. And discarded medicines, etc., are usually disposed in the secured landfill areas where deep cavities, the ground is dug deep and then they are all poured into that and we fill it up with that. And what are the methods of disposal of the biomedical waste or treatment rather? It is by these six methods. One is called incineration, second is called chemical disinfection, autoclaving, microcaving, shredding, and plasma pyrolysis. Now going into a little detail about each one of them. What is incineration? What types of waste are disposed by this method? Incineration is nothing but a high temperature dry oxidation process is known as incineration. So you use very high temperature and there is no moisture in that area at all. So it transforms organic and combustible waste into inorganic incombustible materials. And incineration is usually done for those waste that cannot be reused or recycled or disposed of in a landfill site. An example of that, what you can commonly use for incineration is again we saw in the earlier slide, human and animal waste, microbiological waste, and non-plastic infectious waste. Because as all of you know that if you burn plastic, you get a very poisonous gas called dioxin. So that this should not be burnt as it is. So non-plastic substances only can be incinerated. So coming to chemical disinfection, it is done by hypochlorite 1 to 2% mixed to the waste, which results in disinfection of that material. And then further you can do it into incineration or you can put it into the landfill. And it is more suitable for liquid waste such as discarded blood and body fluids and also for hospital sewage. And how is autoclaving done? Autoclaving is a method of thermal process where steam is brought into direct contact with the waste in a controlled manner for sufficient duration to sterilize the waste. In fact, autoclaving is not only used for biomedical waste, but also it is used still in many hospitals to sterilize our equipment. I do not know how many of you have gone and seen a place called CSSD. You know what is CSSD? How your theater surgical instruments are being sterilized and brought in major hospitals. You have a common area where after usage of all the surgical instruments in the various OTs, they will all be washed and then packed and sent to the area called Common Central Sterilization Unit or the department, where they will be um, first counted, labeled, and then it will be marked as what are the contents in that, and it will be packed, and then it will be either autoclaved or it will be ethylene oxide sterilized. And it will be sent back to the OT from where it was being received. So that is a major department in many big hospitals where individually you cannot take the trouble of sterilizing instruments. But in the earlier days, every theater has to have we used to have an autoclave very near to the OT itself, because the concept of many OTs in the same complex was not there. So individual sterilizers used to be there. And the duty of the theater paramedical people was to clean all the equipments out of blood and other contaminations, and then wash it thoroughly under running water, and then pack them in trays and autoclave them at very high temperature using steam. And once they take it out, it will take some time for it to aerate and then become usable. So they will do it in the evening before leaving the thing, and automatically the steamer will shut off. The next morning when they come, it will have cooled down, and they take out and supply it for the surgeons the next day. This process will go on. So autoclaving is not only used for biomedical waste management, but also for day-to-day sterilization of equipments, which is still in vogue. And it is in biomedical waste management, it is usually for infectious plastic and sharp waste that is used. And the process of autoclaving is saturated steam at 121 degrees centigrade will be pushed into a closed chamber for 30 minutes at a pressure of 15 psi. And this is supposed to disinfect the equipment of all the bacteria, but still the viral spores can be still active. So autoclaving is not a foolproof thing against viral infection, but it is really effective against bacterial contamination. And the way of microwave, how does it work? Which waste are treated by it? So microwave, all of you are familiar with, every one of us may be having it in our house. It uses the radio frequency waves at a frequency of 2450 megahertz. And they produce friction of water molecules, which generates heat. And large size microwaves are used for disposal of biomedical waste, mainly infectious plastics and sharp waste. And shredder is used for shredding the V-shaped or cut into small pieces so that they cannot be reused. That is a foolproof method of preventing reusage of used specimens. And this is the picture of the hospital waste shredded, which one of most of you would have seen. So you put the used syringes and plastic material into that, and that will be cut into very small pieces, and then it will be collected here, and you then take it for disposal. And plasma pyrolysis is the technique where you ionize gas in the plasma state to convert electrical energy to temperatures of several thousand degrees using plasma or torches or electrodes. So this is a more expensive equipment, and the system provides high temperature combined with UV radiation flux also, and destroy pathogens completely. So this is supposed to be a very powerful method of treatment or disposal. And these are the common bins you would have all seen in the hospitals. So this picture is very often given in the OSCE, and they ask you to identify what are all the materials that you will dispose in each color. So remember, black, blue or white is for sharps. This is for animal waste. So whatever slide which you saw earlier is the one which will be asked in the exam. So right. So that is the answer for this biomedical waste. And